In this video, just going to go over how to prime a primary IV line. So I have my primary IV line set. This is for an Alaris pump, but it could also be used for gravity if we were taking that route. Today we'll just show you how to prime it using gravity. So I've checked the expiry date, torn off the top, and got my line ready to go. Just beginning to tear my bag open here, but I've already checked the expiry date. That's the right solution that I want to have as my primary solution. So we can hang the bag up here and take off the cover. Make sure we don't touch that part because that has to stay sterile. If you touch that part of the IV entrance to the bag, you have to discard it. You can't just swab that because it's open there. If it's touched, it's contaminated and we can't fix that. So we'll just leave that there. Sometimes this bit curls up like it's going to touch the bag, and so you want to do what's called getting the memory out of it, and you can maybe do this, just bend it a little bit, and then it almost stays out of the way of touching anything. You want to keep that sterile. When you get your primary IV line ready, the first piece of advice I want to give is just lock it up so that you can control the flow rate, and so you can control the flow of the air and fluid through the line, and you don't get any surprises later on. So just clamp it up. The roller clamp's a good one to use because then you can control the rate once you start running it. This as well is sterile and very sharp. So as you put this into the IV bag, don't just push straight up because you run the risk of spiking through the bag and causing a leak and injuring yourself. But twist from side to side as you're pushing upwards. Don't just twist in one direction, otherwise you'll twist the bag right around at the base and fluid won't flow and you might actually perforate the bag. So it's side to side and upward motion until you've got the tubing all the way into the base of the IV bag. Like that. Then you want to squeeze and fill your drip chamber. 1/3 to 1/2 full is fine. The real principle here is that you want to be able to see drips in the drip chamber while having a little bit of fluid at the base. Then the last thing to do really is just to run the fluid through the line. And in doing that, one of the main considerations we have is that you want to invert the ports on the line as the fluid runs by, so that air will rise past the port and not get trapped in the port. Then the air will be pushed out the end of the line. If you prime it holding the port upwards like this, air will rise and get trapped in the port, and then later on when someone bumps it, the air comes out and now you've got air in your line. So when priming, again, make sure the port is facing downwards so that fluid will fill the port and air will rise past it. So if we just run our fluid slowly here past each port, I'll take a look at the first port. And before I start, one more point. I actually like to remove this end piece once the fluid gets close because I don't want drips coming out, getting all over my contaminated, non-sterile part of the line and potentially working their way back in and touching what needs to stay sterile. So that obviously needs to stay sterile underneath there, and so I'm not going to want to let fluid drip out past the cap because the cap is not sterile on the outside. So I'll show you that when we get to it. Just a heads up that that'll be coming up. So we start our fluid. There it goes. You can see it right there running through. If you can see that on the camera, it's running through. And we've just passed our first port. So I'm just going to clamp to show you. I've passed my first port, so I can let that go. I go down to my second port and get that one ready. I'm going to turn that one upside down, and I'm actually going to take off the cap of my IV now as well, because again, I don't want to risk fluid actually getting contaminated and then touching the tip of the IV. So with my port upside down, I can simply just run the IV, maybe even a little faster now because I've got everything in place. The port's upside down, the cap is off. I can increase my speed and run through the fluid. And you can see I got a few bubbles to get out, so a little bit of extra fluid out, and we are primed. Just gonna roller clamp that down again. Put the cover back on the IV. Nice and dry, nice and snug. And we've got a primed IV line. We're ready to hook that up to a pump, hook it up to a patient, or run it by gravity into the patient IV site.